Let's talk about this car crash we're here on today. Looks like the crash happened on November the 1st of 2015. Did you see Christy shortly after the crash?
Yes, sir.
Okay. As best you can recollect, what can you remember her symptoms? How did she appear to you?
Well, she had a lot of neck pain. She had increased low back pain, and she was having a lot of headaches.
Okay.
She then started to have pain in the right upper extremity, more around the shoulder and upper part of the arm and whatnot. And because of her history of CRPS, and not just the history of the CRPS, the fact of its existence, but the fact that the sympathetic system had been removed, and therefore I had less to work with to control things. I became very concerned that she was developing a migratory CRPS as a result of her injury. She clearly had whiplash syndrome. And that involves injury to the facet joints as well as possible injury to the discs. It also involves musculoskeletal abnormalities secondary to those injuries where you develop a lot of spasm. And of course, if the muscles holding your neck in place go into spasm, they contract. And you saw from the video that if they contract, they're going to more forcefully press against, the vertebral bodies are going to more forcefully press against each other. And if somebody is trying to protrude a disc or extrude a disc, there's more pressure, intradiscal pressure as a result of all of that. So all of those things needed to be addressed. And she had some conservative therapy. She was given cervical epidurals, and where we put an anti-inflammatory medication into the epidural canal to try and calm things down, get rid of the inflammation that could be injuring nerves or stirring nerves up. The last thing I want on her is to have some kind of a nerve injury of any sort. She had a CT myelogram.
What is the CT myelogram?
A CT myelogram is where radio contrast material is injected by the radiologist into the spinal fluid, and then the patient is tilted first one way and the other to get a good coating of the radio contrast material. It's not particularly pleasant, but
when you say not particularly pleasant, what does that mean?
It can be uncomfortable. It can
painful?
It can be a painful procedure. Yeah.
Is it a needle that goes into the spinal column?
It's a needle that goes into the spinal fluid, which means it's deeper, goes more deeply than the epidural needle, and fills up. You have to add fluid to the sac, and that in and of itself can be uncomfortable under normal conditions, and if there's inflammation of a nerve root or something like that, they can be even more uncomfortable.
What is the contrast dye? You said you put in contrast dye into the. What is the purpose of that?
That's to light up and show you the dimensions of the sac that holds all of the spinal fluid, and of course, therefore also holds the spinal cord. And when you look at that, you can see where that sac might be indented if a disc is protruding, or if there's an element of stenosis where the nerve comes out of the spine, and things like that. And in her case, she actually had a C5-6 disc protrusion on the right that was highly consistent with where her pain was located.
Had you seen any damage to her cervical disc or cervical area prior to the motor vehicle crash of November the 1st, 2015?
No.
Do you think this was related to the car crash?
Sure.
Is that your opinion to a degree of medical certainty?
Yes.
And your treatment of Christy both before and after this crash?
Yes.